Hey everybody, this is Matt Shu from Upright Health, and today I am sitting here with Kristen so that Kristen can share her story with you about hip pain and lower back pain. I think her story is really important for many of you to hear, so here we go. Kristen, can you tell us a little bit about what happened, what originally brought you to Upright Health with your hip in your lower back?
Yeah, well, I was a marketing manager for a tech company, so I had to travel a lot, sit long hours in funky chairs and meetings, and then sit long hours at my desk. And then all of a sudden my back started hurting kind of out of nowhere, and it was a gradual pain that got worse and worse and didn't go away. So then I got a stand-up desk. And then my hips started hurting, the left one and then the right one, and then my knee started hurting, and it just progressed from there. My pain just did not go away, and I was only about 26 years old at the time.
So what happened when you went to see doctors and other therapists? What happened? What did they tell you? What information did you get? Yeah.
Well, I was officially diagnosed for my lumbar with disc degeneration and arthritis of L3, 4, and 5. And on the MRI, you could see my L5 was completely just degenerated. It looked like a little sliver. So, and then that was for my lower back, because I also had neck pain at the time, and that was diagnosed with desiccation. Same thing, just degeneration.
And your hip?
Yeah, and then my hip was diagnosed, first the left one was diagnosed as labral tear, cam and pincer impingement, bursitis, and psoas inflammation.
Okay, so you had like a pretty long list of things going on. So what kinds of treatments and things did you try to address all these issues?
First I was just sent to a physical therapist. So the insurance pays for 8 weeks of that, and so I tried that out. I didn't get much progress at all, and the physical therapist, they actually told me I'd never squat again or never do that type of physical therapy. I went to 8 different physical therapists to try to get relief from, because I tried months and months at one physical therapist, and that didn't work, or they didn't seem to have the answers. So then I tried the next one and the next one, and just wasn't getting anywhere with that. Mm-hmm. The next thing I tried was chiropractic care, and I did get some relief from that, but it wasn't anything lasting. Mm-hmm. So, and I was going 3 times a week, but it wasn't lasting for me, and I was still in a lot of pain. The next thing I tried, because I was just desperate, trying everything, was acupuncture. And I tried that for about 3 or 4 months. I didn't get any relief from that. I noticed I could sleep better, which is weird. I'm not sure exactly, okay. but it didn't get any relief in terms of my pain.
Okay. And then you mentioned you've had like injections and things with the hip and lower back.
Yeah. The next thing I tried, actually after physical therapy, in between chiropractic care, I tried hip injections from the doctor. It was steroid injections to see if I was a candidate for surgery. Okay. And they said this would be an indicator that I was definitely a candidate for surgery, which they said I was. And then I also tried PRP injections and prednisone injections, which again I got some relief, but nothing ing, or nothing that seemed like I would progress further.
Mm-hmm. So you ended up coming to Upright Health, and
so then how I came to find Upright Health was I was sitting on the table of I was getting a facial at my esthetician's office, and she could notice I was like squirming. I could barely sit for the 30-minute facial on her table. My low back was killing me. And she was like, hey, you know, I had the same problems with my hips and my back. You should really go check out this orthopedic personal trainer guy. That's how she described him. And so at that point, I thought I tried everything. Didn't think to try, you know, personal training or strength training or, you know, anything like that. So I was pretty desperate. Called him up right there and set an appointment. And within about a month, I could already see lasting relief, and I could see how that could progress.
So you've been training here for a little over a year now. So can you kind of tell us what's going on now with your body? How's it feel? What do you do for your workouts? What's all that like?
Yeah, so I started in about February of 2014 coming to train 2 times a week, and now it's June of 2014, and I am pain-free, hip pain-free, back pain-free, neck pain-free. I had some shoulder stuff which was bothering me. That's better. I work out all the time. I have to maintain, my strength and keep my back strong, but I just went for a 5-hour drive to LA, and that was no problem, where before I couldn't even sit.
You couldn't even sit for like 5 minutes before, right? It was like 10 minutes.
Yeah, I could not sit at all. My 65-year-old mother would have to help me walk around the block because my hip and back pain was so bad, and and she'd also have to drive me to all my doctor's appointments while I laid in the back seat, or even to fly to some of the doctor's appointments, because I flew all over to see the top hip specialists and I'd have to lay down. I'd have to purchase 3 seats so I could lay down and make the flight.
So if you are talking to somebody who has hip or back pain, who has all these crazy things that they're told that they have wrong with them, what would you say to somebody now, knowing what you know now and having your experience now?
I would definitely say, for when you get your don't be alarmed of the scary diagnosis. Disc degeneration at age 26 sounds scary. Labral tear and hip impingement sounds scary, but I am proof that they are curable. I was told I needed surgery by 2 out of the 5 doctors that I saw. They said I absolutely needed surgery, and by multiple of the physical therapists, and I didn't get surgery. And I just did personal training and strength training and specific stretches, and that really alleviated my pain. I realized it was the muscles around my joints that was causing the dysfunction and my pain. So once I addressed that, instead of focusing on just the joint, the damage to the joint, it worked itself out. And now I'm squatting 135. And
good.
Yeah, 3 times a week, and my hips are very happy.
Awesome.
Yeah.
So thanks so much for sharing your story with us, everybody. Kristen is a really good example of what's possible even when you have all these things going on. So I hope that her story helps give you some perspective, and you'll see her in future videos proving to you that she moves very well, and that it is definitely possible to improve your life even when you have all these scary diagnoses in your medical records. So again, thanks so much for sharing your story, and everybody please remember that pain sucks.
Life shouldn't.